What it really comes down to is finding a doctor who cares. I have struggled to find a way to tell people how to figure that out, except for you just have to ask. You got to look into them. You know, social media is a great tool right now for people to kind of look into that. What I've noticed, and now I'm biased because I put out a lot of social media content and I care. So that's my kind of lens framework on, I'm like, well, if other doctors care, and I've seen this across with other physicians, the ones that I know personally, the ones that care are generally more likely to put out good social media content where they're actually trying to educate. If you look at somebody's social media and all it is just advertising for you going to see them, maybe they're more concerned about their dollars than they are concerned about helping. And not saying they don't want to help, because I don't want to make it seem like people don't care, but I just think there's a different layer. There's a layer that you're a healthcare provider and you want to help. And then there's the layer, I think, above that, which is really needed for, you know, some of these patients who are in a lot of chronic pain. And, you know, I'm not a cheap date, you know, to come see me and get injections. You're looking at anywhere minimum $1,000, upwards of $25,000, $30,000 for a procedure. So, you know what I mean? You don't want to just go to somebody who does it. You want to go to somebody who cares. It's their passion. The other thing I've noticed is that really want to work with somebody who focuses, like their focus is injection therapy, regenerative medicine, not something else they do. There's a lot of people out there who, you know, and even in the, we see it a bit more in the naturopathic world because we're generally trained more as primary care docs, and we don't have the silos that the MD world has. But you might find somebody who, you know, they'll work with you on weight loss and hormones and chronic infections and regenerative medicine and stem cell therapy and gynecological issues. And it's just like, whoa, how are you specializing in any of those things? And again, I'm not bashing those doctors because those doctors still get good results with their patients. But what I'm trying to convey here is if you are the type to look for, I want to work with someone who's really, really good, you gotta find somebody who they focus on that intentionally.